Hi, I'm Dr. Scott Jahn, your online chiropractor, and today we're going to be talking about one of the most crucial systems that you have. It's vital for your body's overall function, and it's absolutely critical for your body's healing response. We're talking about your lymphatic system. So what is your lymphatic system? Your lymphatic system is responsible for filtering out your blood. Okay, so what happens is your heart circulates your blood. It circulates it through the arteries and down to the arterioles and eventually to the capillaries. They'll get smaller and smaller and smaller. And the capillaries allow for a single cell to go through at a time. Now, if you have debris like an infection, like bacteria or something like that, it's too large to pass through the capillaries. So they get taken up by your lymphatic system, which then eventually gets filtered out. Okay? But your lymphatic system does so much more than that. It also carries hormones from your thyroid, and it also carries your white cells for your immunity. All right? So anytime you get inflammation, your lymphatic system has been backed up. That's why if you get a sore throat, you'll feel like lumps in your neck. That's your lymphatic system being backed up. So how do you know if you need lymphatic drainage? Well, one clear sign is if you feel groggy in the morning and then it takes you a little while to get going, you start to feel better as you move around. Okay, that's usually a lymphatic problem. The reason being is because your lymphatic system doesn't have a muscular contraction of its own. So the way your lymphatic system get drained is by movement, by contraction of muscles. When you're sleeping, you're not contracting muscles, so lymph tends to coagulate. Right? So moving around gets that lymph flowing, and you start to feel better. The symptoms that you might notice with lymphatic problems is any kind of swelling, right? So you can get swelling in the arms, you can get swelling in the legs, you can get varicose veins, you can get skin problems like eczema, right? It can cause ear and eye problems like tinnitus or vertigo. Okay? You can also get what's called bruxism, which is grinding of the teeth in the middle of the night. That's a classic sign that you need lymphatic drainage. In addition, you can have cholesterol problems that could be a lymphatic problem. The reason being is because your lymph carries cholesterol, and what happens is your body dumps excess cholesterol and it dumps into large intestine, and then it gets fed back through from the large intestine through the lymph to the liver, which gives it a feedback mechanism. Now, if your lymph's not flowing properly, your liver doesn't get that feedback mechanism and just keeps making cholesterol. Okay? Other things would be things like poor wound healing. Okay? If you're diabetic, right, ulcers in the lower part of the body, you'll notice that your lymph gets congested, especially in the inguinal area right in here, long before you get ulcers. So that's a key sign that you need to drain your lymph. So there's many different reasons why you need to drain your lymph nodes. So what we're going to do is I'm going to teach you how to drain that lymphatic system. That's not only going to help you to drain toxins, but it's also going to help as far as circulating your thyroid hormones and also circulating white blood cells for immune function. So let's get started. So when we talk about your lymphatic drainage, your lymph drains into two areas. One's called the right lymphatic duct, which is located on the right side, and the other is the left thoracic duct. Now, the right side is responsible for the right part of the head, right sinuses, okay, the right lung, right part of the heart, and the right chest. The rest of the body all dumps into the left side. So depending on if you have symptoms like sinuses on the right side or headache on the right side, okay, you would pay more attention to one side versus the other. And the way we're going to drain this is we're going to show you a couple different methods, right? The first thing is you're just going to use your hands, okay? So we're going to start with the left side. And you're going to start here, and you're going to go from the left shoulder towards the heart, okay? You're going to stroke it down about 5 or 6 times, okay? You're trying to help push that lymph towards the heart. Once you do that 5 or 6 times, you can do the other side 5 or 6 times, okay? Always pushing towards the heart. Okay. After you've done that 5 or 6 times, you're going to work the lymphatic chain that's in your neck. Now, a good way to find it is just to turn your head, and you'll see this muscle stick out, which is called your SCM, or sternocleidomastoid. Now, you have a lymphatic chain that runs both sides and one deep. So you're going to take your fingers like this, and you're going to come on either side of that muscle, and you're just going to pinch and run in circles down. Now, you don't want to press too hard because you also have a carotid artery in there that you don't want to compress. So you're just going to pinch. And if you feel a nodule in there, spend a little extra time of pinching that and moving it down. And just move down. And then grab 2 fingers and just gently push down. Okay? and you're going to do both sides. And then again, come back to the chest and clear that out. Now, same thing on the arm. The lymphatics run along the inside of the arm. So you would just take your arm and you would run it on the inside up to what's called your axilla, otherwise known as your armpit. Okay. Next, we're going to go down. You have lymphatic chain on your stomach. Okay. So on the other side of your umbilicus, otherwise known as your belly button, you're just going to pull up. Okay. And always 5 or 6 times to each one. And then finally, you're going to go down to the legs. Okay. Start at your ankles. The lymphatic chain runs on the inside, and you're going to come up 5 or 6 times up to the knee, and then 5 or 6 times from the knee, coming up to your hip. Okay. After you've done 5 or 6 here, 5 or 6 here, you're going to come to the inguinal canal, which is where we have a group of lymph nodes right in this area. So again, you're going to try and do circles. Use 3 fingers, circles up towards the heart. Always kind of like this. Circle up, circle up, circle up, circle up. And if you feel a little nodule, spend a little extra time on there, trying to milk it up towards the heart. And then once you've gotten the leg cleared up, come back to the stomach, and again, up here. So you do this a couple times a day, and that's going to help clear your lymphatics. Okay. Now I'm going to show you a couple of tools that you can use to make this a little bit easier. So the first piece of equipment we have is a massager. Now I got this for about 3,000 pesos, but you can find them up to as cheap as 1,000 pesos on Lazada or Shopee, or Amazon is always a good place to look. So what you would do with this is you would just run it smoothly right down. You run it right down toward the chest. And again, you're going to go very light. Okay? You don't need to go very deep. Just very light towards the heart. Okay? Same thing if you're going to go on the arm. Very lightly. Just pull it up. Okay? And then same thing on the leg. And here as well. So that's one option. A second option is to use a rolling stick. Okay? So same thing. Now this is going to be hard to get on the arm because you need both hands. But for the legs, you would just take it, and again, you're going to roll up towards the heart. Makes it a lot easier and a lot faster. Okay. But for the upper body, you're going to have to use your hands or something else. So now that we've showed you how to drain your lymph nodes, we want to talk about something else that's causing this lymphatic drainage. We mentioned earlier that your lymph drains into the right lymphatic duct and the left thoracic duct. Now those ducts, they lie underneath a muscle called your pectoralis minor. Now, pectoralis minor connects here to 3 ribs here, part of your scapula to ribs. Now we'll notice these pec minors are tight if we have forward rounded shoulders, which most people have because we sit too long and we sit our shoulders round and we have a rounded upper back. That's usually caused pec minor tight. So we want to make sure that we get this pec minor loose and get it open up so that the lymph can drain. Okay? And one way we're going to do that is we can use a foam roller or a ball. Now if you don't have a ball like this, you can use a tennis ball, which will work too. Okay? Just know that the smaller the surface area, the more painful it might be. So a larger ball will be a little bit easier. And we're going to get a mat and I'm going to show you how to do this. All right. So we're going to use this ball to try and loosen up that pec minor and help bring those shoulders back. What we're going to do is come down on the mat, and you're going to put this on that little indentation in the front of the shoulder, like this. Put your arm out, and you're just going to roll it down towards the mid part of your chest or your sternum. And you're going to feel for any areas that are tight or any trigger points. And you spend a little bit of time on that and just roll it away. So spend about 2 minutes on each side, rolling those chests. Again, muscle goes down like that, so you want to roll down that way. In addition, you can use a foam roller. You can do the same thing. Put your chest on it, and you're going to roll. It's not quite as specific as the ball, but you can get a decent roll there as well. finally, if you don't have either one of these, you can just use your hand. And the way you're going to use your hand is you're going to get under your pec. So pec comes in here. You want to get under it from the armpit, and you're going to almost try and pull your pec forward. You're going to pull up and forward, and then bring it down. Okay? You're almost kind of trying to strip the muscle under there. Okay? But the ball works much, much better. So what that's going to do is it's going to help open this up, right? Bring your shoulders back. Now, there's another reason why you can have forward shoulder roll. One could be because your lower traps are not strong enough. And so we're going to show you an exercise how to strengthen your lower traps. In addition, your rhomboids could not be strong enough to hold you back, and also your serratus anterior. So I'm going to show you three different exercises for those to help pull you back. And then finally, you could have what's called a subluxation in your mid-back, right, which is a misalignment of the bone that's preventing you from having good posture. Okay? So let's start with the lower trap muscle. Okay? Okay, to work the lower traps, you can use some weights, or if weights are too much, you don't even need them at all. But what you're going to do is, you don't need a lot of weight, maybe 2 pounds at most. You're going to go on a table or a bench, arms go extended, and you're going to come up in like a V. Like that. You're going to do about 10 repetitions and do about 2 or 3 sets. So I'm going to teach you a little trick. That's an insider trick that most people don't know, but what we do in the clinic. Okay? We talked about having weak lower traps, which are right here, which cause the shoulder to come up and around, right? Which will cause a tight pec, which will cause the inflammation and cause your lymph not to drain. So one thing you can do to turn on those lower traps, we already showed you the exercise, is right on the left side, right about where the ribs come together, okay? In between the ribs, you want to rub in a circular motion from right in between the ribs all the way to mid-armpit. It's going to be the 7th intercostal space. Intercostal means between 2 ribs, okay? And just rub. And you should feel a little bit of a soreness somewhere in there. Okay, that's going to help turn on that lower trap. Now, if we need to turn on the pec minor, that reflex is right above what's called the xiphoid process, which is that little end point of the sternum. Come right above that and rub there. You need to rub vigorously for about 2 minutes. Okay? So either one of those points, if they're very sore, okay, that's going to help turn on those muscles. Okay, next we want to work your rhomboids. And the way you're going to work your rhomboids are, you're going to be in the same position, only your arms are going to be in like an H position. You're going to bring them up and like that. Up and externally rotate. Up, squeeze your shoulder blades together, externally rotate. Up and externally rotate. What that's going to do, it's going to pull you back, and because our arms always internally rotate, we want to externally rotate to open everything up like that. Okay? Something called your serratus anterior. Your serratus anterior connects here and it connects to your scapula. And when that's weak, what you'll find is that your scapula will wing, kind of like when you do this, the scapula bends out. So if your scapula gets winging, this exercise will be beneficial. What you're going to do is come down to a push-up position. Now, if this is too strenuous, you can do from a kneeling position. But you're going to come down here, you're going to squeeze your shoulder blades together and push them up. Squeeze shoulder blades together and push them up. So that's the movement. You want to keep your joints nice and relaxed. Okay, you never want stiff joints. And push. So this works your serratus anterior, keeps your shoulder blade where it's supposed to be. Now, if you watch one of my earlier videos talking about core and bracing exercise, this is essential, especially with things like we're doing right here. So if you haven't seen it, go back and watch that video. Because if you don't have a strong core, what's going to happen is when you're like this, your body's going to sag like this, which is not what we want. We want to make sure we're up in a nice strong core. So we want to take advantage of that bracing exercise that we learned earlier. Okay, so now that we strengthen some muscles, that helps keep the shoulder blades in its proper place, back and retracted. There's a couple muscles that we need to stretch. Right? We talked about already the pec minor. We want to stretch the other pec muscles, which are here, and also the lats. So to stretch the lats, you want to find a bench. You can use a chair too. And what you're going to do is put your elbows on, and you're just going to drop down like that. And that's going to stretch your lats, which are here. A good way to know if your lats are tight and it's causing a problem is to just go up against the back of a wall and see if you can put your arms straight up like that. Okay? If you put your arms up and they either come to the side or they don't go flush against the wall, it's because your lats are tight. And this exercise is going to help you a lot. Elbows on, drop your body back, and just sit down. You're going to hold this stretch for about 90 seconds. Now to do a pec stretch, right, which stretches here, what you're going to do is lie down, arm out, and you're just going to roll. And you're stretching your pec. And again, hold that stretch for about 90 seconds. So another way to stretch a chest is with a standing chest stretch. What you can do is find a wall or some kind of a barrier. And put your arm level. Okay? Take the opposite leg, step forward, and you're just going to lean forward and then slowly twist away. And you should feel a stretch right in that pectoral area right there. You're going to hold that for about 90 seconds. So one thing I should mention, okay, if you have cancer, this is not for you, right? We don't want to increase any cancer cells into the rest of the body. So if we're doing lymphatic drainage, do not do this if you have cancer, okay? But everybody else, it's safe to do, right? Unless if you have a skin lesion over a certain place, you obviously don't want to rub over that skin lesion as well.